And is Chuck here? I was going to say, we already heard from. Let's all give him a standing ovation. No. That's the kind of smart ass I am. Hi there, how you doing, sir? I told everybody we were going to do a standing ovation.
Good to see you, Chief. No, thank you. Apologies, we can
No problem.
thank the 70-mile-an-hour Gus and United Airlines.
There you go. Chuck, you're first. Floor is yours.
All right, Chairman Simpson, Ranking Member Pingree, and members of the Interior Subcommittee, it's a pleasure to speak to you once again. As Principal Chief of the Cherokee Nation, my foremost responsibility is the welfare of our 475,000 citizens and the protection of our sovereignty. The Cherokee Nation Reservation is the home of some of the strongest efforts in Indian country to increase the quality of life of dozens of communities and hundreds of thousands of people. It's the home to an array of diversified tribal businesses and effective strategies for economic development and cultural revitalization. Our reservation is the home of the largest health system in Indian country. Now, Chairman Simpson, last year you and I discussed the fact that our reservation, our nation, is the home to America's first medical school in Indian country, the Oklahoma State University College of Osteopathic Medicine. I'm proud to report to you now that in 2027, we'll open a nursing school with the University of Oklahoma within walking distance of that medical school on the state-of-the-art Cherokee Nation Health Campus in Tahlequah. All of these efforts by the Cherokee Nation and many more relate to a single idea, and that's tribal sovereignty. As you write and consider the FY27 spending bills, I would ask you to keep that word in mind, sovereignty, keep it top of mind. The federal government must meet its commitment to tribes, but Congress should not tolerate wasteful spending, duplicative spending, or spending that undermines tribal treaty rights. And so our first recommendation is close scrutiny of agency decisions or budget requests that produce waste or undermine treaty rights. My written testimony points to multiple places where this is occurring. That includes the Purchase and Referred Care Program within the Indian Health Service and the Johnson O'Malley Program within the Bureau of Indian Education. Agency lawyers and bureaucrats are disregarding treaties, existing law, congressional intent, and outright logic. The result is waste and redundancy. Generations of Cherokee Nation citizens fought too hard and lost too much to have federal bureaucrats ignore treaty rights that date back to the country's founding and which have been validated by the courts. Cherokee Nation is the exclusive tribal sovereign over our reservation, and we should be treated as such. When agencies ignore this, they not only disrespect the Cherokee Nation and set a terrible precedent, they waste taxpayer money. I've read the submitted testimony of the United Kituah Band of Cherokee Indians. I won't respond to all of their outlandish claims about the Cherokee Nation, but I will simply remind the committee that the Cherokee Nation is the exclusive tribal sovereign governing the Cherokee Nation Reservation. We are the exclusive tribal party to the unbroken chain of Cherokee treaties. The UKB's reliance on the Department of Interior's M opinion, which is suspended, carries zero weight. That opinion was issued by a Biden political appointee days before President Trump took office. The Trump Interior Department immediately suspended the opinion. The opinion's analysis exists in a fantasy land free of facts, law, and logic, and is neither binding nor persuasive. UKB's healthcare claims are utter nonsense, and calls for new or recurring funding should be rejected. Congress should not allow a federal agency to prop up a duplicative healthcare system across our reservation where we already provide health services to every federally recognized tribe citizen, including UKB citizens, through our health system. To tolerate otherwise is fiscal insanity. My second point is that the 8A program works. It works for Indian country. It provides tribal self-sufficiency. It's under attack. We need this committee's support for the 8A program. Third, we'd ask the committee to continue to provide funding for those tribes directly impacted by the McGirt case. The McGirt and Hogner cases reaffirmed our status, the Cherokee Nation, as the exclusive tribal sovereign within the Cherokee Nation Reservation. Since then, we have met the moment, but doing so takes considerable resources. This committee has been there for the McGirt impacted tribes, and I ask for continued support. Fourth, the committee should support tribal self-governance and self-determination by encouraging agencies to fully implement ISDEA programs and the 477 program. Self-governance works. When we administer programs for our own citizens directly, we do so more efficiently and more effectively than the government of the United States. Committee report language should support maximum use of those programs. Finally, agencies need a reminder that meaningful consultation is required. The Departments of Education, Interior, and Labor have fallen short this past year. Tribes were not afforded an early opportunity to provide meaningful input on structural changes in those agencies. Language from this committee can help ensure that early consultation occurs so that agencies can meet their legal obligation. I appreciate the opportunity to testify and welcome any questions.
Thank you. I appreciate your testimony. You're suggesting that notifying you is not consultation.
Particularly when it's late.
We can get into that. Genovi, is that right? It's John. Okay.
Well, good afternoon. Sorry for giving folks a heart attack again. Courtesy of United Airlines, I had a wonderful detour to North Carolina, and so I'm here now. But XG, John Dev Chowdhury, Jijif Kados, Nagazalgi, Niyaka, Atodos. Chair, Ranking Member, it's an honor to be before you again. Thank you for the opportunity to testify. My name is John Dev Chowdhury, and I'm honored to serve as the ambassador for the Muskogee Creek Nation. Affording tribal nations the platform to share feedback and suggestions for improvement over the annual fiscal year cycle is crucial to improving and enhancing federal budget strategies to best serve tribal nations and uphold treaty rights. As one of the largest federally recognized tribes in the United States, with a reservation spanning over 3.2 million acres, home to well over 1 million people, and covering 8 full counties and parts of 3 more in eastern Oklahoma, our reservation is divided into 8 legislative districts corresponding with 8 counties in eastern Oklahoma. We represent the interests of over 100,000 enrolled citizens, as well as many more Native Americans and non-citizens who call our reservation home. The funding requests and recommendation provided in this testimony are grounded in our commitment to tribal sovereignty and operating as good faith partners in our government-to-government relationship with the U.S. federal government. This relationship has been built on the deep-rooted obligations, financial and otherwise, mandated and guaranteed in treaties and agreements entered into with the Muskogee Creek Nation. Bears remembering, without these treaties, the United States wouldn't be here. It is our intention that MCN's testimony can serve as a stepping stone for improved dialogue and partnership between Congress and tribal nations. A substantial funding gap still exists for Native American programs at DOI, particularly BIA programs, and there is an ample amount of work to be done to fulfill the federal government's treaty obligations. As a sovereign body, the Muskogee Creek Nation has an inherent responsibility to ensure public safety within our reservation boundaries. Since 2020, the Muskogee Creek Nation has undertaken a large-scale capacity building effort to deliver effective public safety services in a complex jurisdictional environment. We've executed more than 60 cross-deputization agreements with city governments, municipal partners, and state agencies to ensure seamless coordination across jurisdictions. Over the same period, we expanded our light horse police from 30 officers in 2020 to 133 acting officers today. Since 2020, Muskogee Creek Nation has received thousands of criminal referrals from non-Indian governments and has referred just as many criminal matters to non-Indian governments and issues hundreds of civil and criminal sanctions every year for traffic violations. Our efforts have been complicated by the Supreme Court's Castro Huerta decision, as some local authorities have relied on that decision as a basis for refusing to inform us of instances where our citizens are victimized on our reservation. We look forward to working with Congress in our effort to find a solution to the problem caused by Castro Huerta. We encourage Congress to retain funding levels for public safety in courts in Indian country and consider increasing capacity building funds. An increase in capacity building funding would allow MCN to address challenges and enhance the efficacy of our justice system by hiring additional judges, prosecutors, public defenders, and court staff, and to address the urgent need for additional court facilities. We also encourage members of Congress to work with the tribes in crafting statutory language that would create a joint venture construction program in which tribal nations could partner with the Department of Justice to construct or refurbish detention facilities in the same way that tribes do with the Indian Health Service to create new health facilities. Furthermore, based on FY24 funding levels, there exists a funding shortfall of over $12 million for Creek Nation's agriculture and natural resources programs and functions. Therefore, the nation would request that the House retain existing funding mechanisms and consider increasing capacity building funds to support land management and development activities. Creek Nation also respectfully requests, just as our Cherokee Nation partners have, an increase in the current funding levels for the Johnson O'Malley program, adjusted to reflect the updated student counts following the full implementation of JOM Supplemental Indian Education Program Modernization Act of 2018. The Creek Nation is thankful for the opportunity to provide testimony before you today, and we look forward to working with you to work across Indian country to promote responsible appropriations that honor the trust responsibilities of the nation and recognize tribal nations as effective stewards of public lands. Mado.
Thank you. Let me first ask, Chuck, you talked about the difference between the Cherokee Nation and what was the other?
The United Kituwa Band of Cherokee Indians, UKB.
What's the basis of that? Why is this difference going on?
The Cherokee Nation is the same Cherokee Nation that was here before anyone ever heard of the United States.
Yeah.
The first treaties were Cherokee treaties between the Cherokee Nation and the United States in an unbroken manner to the present time. The United Kituwa Band of Cherokee Indians in Oklahoma was created by a statute in 1946 by this Congress as a band of Cherokee Indians, is literally what the statute says, and recognized in 1950. The issue relates to the authority to govern the reservation, of which we possess exclusive authority. And what we have found, though, is confusion among agencies that begin to stand up federal programs, fund healthcare programs that are duplicative. I mean, you could literally go into our capital and see that there are our health system, which is the gold standard in Indian country, and another health system cropping up using taxpayer dollars. This is the fiscal insanity that I'm talking about. And it's something we work very hard to address, and we think that the committee should scrutinize any request that is duplicative, and we can flag a number of those, including healthcare, JOM, and others.
It's duplicative because of the way DOI does things?
It's duplicative in the sense that if we're administering healthcare, for example, we provide it to all members of every federally recognized tribe. And we have put decades of work into it to the point where we have, I really do believe, the gold standard. And so seeing additional, very scarce federal dollars go into building up a duplicative healthcare system, I think if any American looked at that, they would say, this does not make sense. And it doesn't make sense.
But what I'm asking is,
Mhm.
is that duplication because of the way we're appropriating dollars or the way DOI is administering?
It's the way the agencies, including DOI, are administering that. We think it's non-compliant with the law, and we think that the committee has a role in scrutinizing requests that plainly set up duplicative systems, and we have flagged that in the written testimony in particular.
Okay. Uh, I got in this and I forgot what I was going to ask you. I had something. Let me turn it over to Shelley and I'll think about what I was going to ask you.
Great. Well, thank you, Chief Hoskins. It's nice to see you again. And I will say, when I had the opportunity to visit your community, seeing the medical school was really impressive. Just the idea, and I think the chair was talking about this earlier, the importance of training people in Indian country to go back and work in Indian country. And not everyone will necessarily, and some people will come in from the outside, but it's such a critically important thing to do, and to have a high quality medical school. I'm thrilled to hear you have a nursing school as well. Yeah, and I will definitely read through all the testimony and get to know better some of the challenges that you're talking about. But thank you for being here with us today, and thank you for being here. And I know, I think you both brought this up a little bit, but some of the challenges through McGirt and then through the Castro Huerto complications on top of it boggle my mind. But it is something I think the committee keeps in mind all the time, with the unique situation that you have there in Oklahoma and this sort of jurisdictional challenge. So our full chair isn't here, but when Mr. Cole is here, we can usually get a few extra dollars out of him if we just say the word McGirt. So I've learned to put that in the top of my vocabulary just to help us
Absolutely.
increase our allocation, because we just know that's really, it's a big bill, but it also addresses one of those challenges that we see a lot about this jurisdictional issue and sort of a unique situation that you have in Oklahoma. So we'll continue to do whatever we can to help.
Thank you, Ranking Member. Dollars are always welcome, and certainly the capacity building that I mentioned relies on appropriate funding. However, addressing the legal jurisdictional problems created by Castro Huerta remain a priority, and there are a dozen cases right now where folks are improperly referring to Castro Huerta's dicta to argue that our sovereignty does not exist. And until Congress can lend its voice to the clarifying the very devastating Castro Huerta decision, I'm afraid we're going to be spending dollars that could be going to public safety, could be going to health programs, fighting these ridiculous arguments. So thank you.
Thank you. Thank you both for being
Mr.
here.
Elsie?
Thank you, Mr. Chairman. Thank you all for being here. Sorry I was a little bit late. I grew up as a neighbor of Oklahoma, in the northeast corner of the Texas Panhandle, Perryton. I count the Kiowa as my neighbors. And I was noticing that the Cherokee and the Creek occupy about 15 to 20% combined of the territory of Oklahoma. And since I missed most of the discussion about what you gave in your opening statements, I was curious, with that big of a border in between your two nations, in what ways do you cooperate in ways that are innovative that we might be able to help out going forward, finding ways that your two nations can collaborate and we can assist?
Well, I would say, Congressman, that we have a great admiration for each other's law enforcement in this McGirt era, and our law enforcement agencies work well together. And if they, in law enforcement, if you're not working well together, people are getting hurt, people could be getting killed. It's unsafe. And so I think anything that can enhance the working relationship between tribes that, as the Muskogee Nation and the Cherokee Nation, not only share a border, but a border in an urban area, Tulsa, where there are great challenges for any law enforcement agency. So I think that's one way that we work together.
Yeah, and on behalf of my chief, we'll always defer to leadership of any nation especially Cherokees and my nation. But on behalf of my chief, I want to echo Chief Hoskins' comments. Historically, and I can say this because my wife's Cherokee, we fought for millennia. But that does not mean we don't have shared interests in supporting tribal sovereignty and protecting everyone in our borders. And that's been the biggest messaging point that we've tried to make. Despite the sky is falling narratives, we're good. Pandemic struck, we provided vaccines to everybody in our borders. Didn't matter if they were native or non-native. We are good partners to each other, but more importantly, we're good partners to every person within our borders.
Does Tulsa lie within completely the Muskogee Nation territory, or do y'all
I
split?
think so. They have a little sliver up north.
Okay.
We have a good chunk of the.
So as we talk about the coordination of law enforcement,
Yeah.
has that reared its ugly head in a negative way, dealing with the city of Tulsa and anything that might occur on the res with somebody coming from Tulsa doing something bad? I mean, because this is my third time doing this, and we continue to hear about the atrocities being committed by people who are non-native, and then fleeing justice. And I see some of our friends are going to talk later about that. Is there something that we can improve in this committee with that coordination?
I think drilling down to the facts and frontline experience will be revealing. And if our marshal of the Cherokee Nation were here, our top law enforcement officer, he would share with you that the Cherokee Nation Marshal Service has an excellent working relationship with the Tulsa Police Department, cross-deputization relationship. But these really do come down to relationships. And I think that is a difference maker in Tulsa. There in an urban area, there will always be an opportunity for those who want to create a narrative to find something that did not go perfect. I've not met a law enforcement officer that says every day is perfect. In fact, most days are
Yeah.
not. But I think that if you go, what this committee could do is some real fact finding and sort of push through some of the rhetoric, the sky's falling rhetoric, with Jonathan and I both been on the receiving end from some leadership in Oklahoma. I think you would see that the real reality is a real working relationship that protects people.
Thank you.
And I would just echo Chief's comments, but also my own comments about Castro Huerta. So when we're talking about a cooperative, landscape, it starts with clarity. And unfortunately, while Tulsa has been, by and large, a very good partner, I'm not going to throw any counties under the bus or any specific municipalities. Not all counties and municipalities have been equally cooperative. And in some cases, through lack of referral of information, there's been a direct attempt to sabotage those relationships and basically create a narrative where McGirt's a problem rather than an opportunity. So clarifying the jurisdiction's part of it, but certainly funding, everything starts with funding. We blend our own funds with federal funds to support our light horse. 133 officers is a huge force, but we are protecting everybody in a jurisdiction that has about 1 million people in it, along with our partners. So at least in Tulsa, things haven't been perfect, but things are good. I don't want to throw, I'd be happy for our nation to follow up with more specifics if you'd like.
That's what we're here to do. We're here to try to improve it. And if it's already working well, and you guys said, you're increased, but it's not enough. So that it's an evolving process where, as long as we're making progress, that's what I'm interested in.
Yes.
Thank you. I yield back.
I appreciate it. Now I remember what I was going to, it was about law enforcement when you were talking about your 130 officers and stuff like that.
Yes.
Are there cross-deputization between your two tribes?
Cross-deputization between, I don't know that there's
Well,
cross-deputization.
well, I mean, there's a whole slew of historic cooperative relationships. So, Chief Hoskin works with the Intertribal Council that has a public service, a public safety funnel to it. So our officers talk on a daily basis. We're clear where our jurisdictions begin and end, but it's seamless across our border.
I would agree with that. And our top law enforcement officer knows the Muskogee Creek Nation's top law enforcement officer on a first name basis. And if there's an issue, there's a phone call, not a let's pick up sides here. It really is.
Because I got to tell you, in all honesty, jurisdictional issues on reservations are confusing as hell to me. And it depends not just, I mean, like, what happens if one of your tribal members commits a crime on your reservation? What happens if it is a non-member, white guy that comes on your reservation who has jurisdiction? I mean, I get so confused when I start looking at the jurisdictional issues, and I think it leads to an awful lot of problems in terms of when you look at the murdered and missing Indigenous women and stuff. We had the FBI in here and everybody else testifying and stuff. And I'm just shaking my head at the jurisdictional issues. I'm one who believes that your reservation, you ought to be able to do what you want on your reservation. And that's, but we seem to complicate it a lot.
I think there is complications caused by the government of the United States, but I think to the extent that there are dangers, it's created by gaps in resources. And so to the extent that tribal nations are able to put their own resources and have federal resources brought to bear, the complexity can be understood and the relationships matter and the funding matters. And so in a complicated world that may be difficult to unwind over the centuries at this point, I think bringing our best effort to law enforcement, and it really is about relationships, makes a difference in our in Cherokee lands, and I see that in the Muskogee Nation as well.
And Chairman, I appreciate the insight of your comment in terms of taking the handcuffs off of tribes. So one of the reasons we're like a broken record about this Castro Huerta decision is Indian law was complicated enough, but to try to pretend that a reservation in Oklahoma is different than reservations elsewhere creates a whole additional level of complication that law enforcement, that prosecutors have to deal with. When I practiced for 20 years, and reservation was a reservation. And that's important because if you're talking about local solutions to local problems, there's no better friend than tribal nations in terms of going after bad guys and keeping people safe in their, within our borders. If we don't have authority to go after bad guys, we have to rely on other agencies' priorities. There's an old saying that nobody washes a rental car. If we have to rely on the U.S. attorneys, great as they are, and FBI to have our priorities in terms of going after bad guys, we'll never be able to go after bad guys. Same thing with the state. So we are partners, and it comes down to funding and jurisdictional clarity. So we are broken record about Castro Huerta,
Yep.
And there's some ridiculous dicta in that decision. But we're working through it, and we're working through it in the best interest of everyone in our borders.
I appreciate that. And I will tell you, last year we had a hearing on murdered and missing Indigenous women, which is a travesty in this country that we're going to address. We had a lady testify. She was a member of their tribal council. When she was a young girl, she was abducted, taken to a cabin, held for about a week, raped, beat up, all sorts of stuff. And then she was dumped off the reservation, alive, off the reservation. So all of a sudden it was, well, whose case is this? She couldn't identify the cabin that she was held at. She could identify the person, but she couldn't identify the cabin. So they're sitting there. Is this an FBI issue? Is it a county issue? Is it a tribal issue? Who's got jurisdiction over this? And I'm kind of going, this is crazy. That's today, that individual that held her is one of her constituents. Now that's a tragedy. And that's what leads me to this. We got to solve this somehow. And I'm more in that camp of, as Congressman Elsie said, nobody cares more about tribal members than tribes do. You guys ought to have jurisdiction over your tribes and your territories on your reservation and stuff. And somehow that's deeper than what our committee does here on appropriating money, but we need to get the resources committee and some others involved, and we need to solve this damn problem. But let me congratulate you on your educational initiatives. I've always said that the only way you're going to get doctors, dentists, nurses, others, professionals out on some of these reservations that are a long way from nowhere is to educate the tribal members and let them become the doctors and dentists and stuff, and they're more likely to come back and serve the tribes and stuff. So I congratulate you on that. Anyway, thank you very much for your testimony. We appreciate it. Look forward to working with you as we put together this bill this year.
Thank you, Chairman.
Yep, I know. Yeah, that's right. James Dorano, Charles Riley. How you doing?
How are you, sir?
Good. James, you're up.
Umbi agin ni nawe ba kina agin ko wagri ne wawi tung jong na mo ne wawi tung jo ho na mo ne wawi kamiri na mo wagri nawe ba kina agin ko he wana pundi he wana sogiri ne wawi wegaja ne wawi wati o ti he hanto kri ba kina chamu ba kina agin huwiri ne wawi tung jong na mo hapo ongepe ne wawi wegaja. Chairman, members of the committee, James Naranjo, Governor of Santa Clara Pueblo, I lay my respect down to you. Our Tewa language is our first language. English is our second language. Spanish is my third language. I'm a retired lawman from the state of New Mexico. I did over 23 years. I was a correction officer at first, and I became a lawman. I did SWAT. I did traffic homicide. I did canines. I was a cadaver finder. I did that for many, many years. I'm glad to be back in front of you again, sir. And I retired to take care of my parents, and I've been with the tribe now 14 years. So I got kind of trapped into tribal politics, and I'm very, very blessed to have 3 sons. One that served in the Navy, retired as a corpsman, did a couple tours in Iraq. Pray for our servicemen out there battling the war and service women. I also have a son now currently that's an FBI agent that we prayed many, many years to come to northern New Mexico to help us put a dent in crime. And so and then I have a son that works at Delta Airlines that's waiting for me to retire one day so I can travel around the world. But I'm from Santa Clara Pueblo. If you've ever been there, we welcome you to come out to our homeland. We've been there since time immemorial. We're one of our Pueblo people with my brother here from Acoma. We've never left our homeland since time immemorial, and we're still there. In 1540, when we made contact with the Europeans, we fought off the Spaniards, the Mexicans, the United States, and other tribes. And we're still holding on to our sovereignty and to our ways of life. Our culture, our traditions, our languages is the glue that holds us together. It's what keeps us, our small tribe. We have about 56,000 acres, have less than 2,000 members in our tribe. We have a beautiful landscape. We live right along the Rio Grande River, and we're very blessed to hold on to those water sources and to our way of life. As I mentioned, I'm a law enforcement man, and I appreciate the comment that you mentioned earlier. I've been trying to find solutions in our fentanyl crisis. As you know, Santa Clara Pueblo is incorporated by the city of Espanola. That one time was the capital of the heroin crisis, you know, from pot to cocaine to heroin. Now we're in fentanyl, methamphetamines. We currently have about 20,000 people that are non-members living within our boundaries. We talked about and how we support police parity. We have maybe 8 law enforcement. I wish I was like the other tribe and had 100 law enforcement. But we only have 8 law enforcement officers, and we're a self-governance tribe, but we're within the city of Espanola, the county of Rio Arriba, and Santa Fe County. We asked you talked about the transparency and the cross commission. The cross commission's there, but it doesn't come with any funding. It comes with just the work. And the crimes committed within our jurisdiction are either the private claim or from the non-members, as you mentioned. Santa Clara is one of the first tribes in New Mexico that implemented VAWA for that reason, the violence against women. And I've been a strong advocate since I was a young police officer, working for U.S. Customs, the FBI, trying to bring closure to some of these missing, not only Native women, but all women and children and men that are missing. And, it's unfortunate that it's closure that is the ultimate outcome, not because the majority of the women that I found were deceased, but at least it brings closure to these families. And now with this fentanyl crisis and that, and we appreciate the bipartisan efforts to support our IHS programs for behavioral health and for rehabilitation, and for the money to how do we retain our officers? How do we retain our dispatchers? When our neighboring counties, Los Alamos is one of the highest paying counties in the country, Santa Fe County as well, the state police, we lose our officers. We're like a training facility, and it's not fair to us, and yet we're in the heart of all these things. So we try to bring solutions to the table, across commissioners, but give us a reimbursement. We don't mind fighting crime, and we don't mind protecting not only our citizens, but the whole citizens that come up and down that corridor. And it's very challenging for us when we're losing teachers, we're losing janitors, we're losing police officers, we're losing all of that to the higher paying county. And how do we do it as a self-governance tribe to retain that? It's very challenging for us. So we have to supplement our tax budget. We have to supplement our budget just so that we can retain good qualified officers to protect our people. And those are very, very challenging. We're trying to educate our young children on how fentanyl, on how these drug and alcohol abuse is affecting us from a second, third grade level now. Before, you never even heard about those things. It's just alcohol and pot. Now it's all of those things that are devastating not only our community but every community. We have maybe about 1,000 homes in Santa Clara Pueblo, and each home has been affected one way or another. I can go to every home, and it's not only our home in the Pueblo, but it's almost every home in the whole valley of Española, northern New Mexico. There's one way or another they're being affected, and how do we break that cycle together with the trust responsibility from the government? How do we try to break that cycle? We have to send our children outside to treatment centers across different countries because of the cost, and then we bring them right back and put them right back into the same rat hole. And now we're buying our property back. Santa Clara lost more land to private claim than any other Pueblo, and we're trying to buy our property back so that we can establish regional treatment facilities, traditional and non-traditional, to heal our people and to put them back in the workforce. But it takes money, it takes effort. Our behavioral health program do extremely well job and all educated. As you mentioned, we send our children elsewhere to get educated and to come back and help and work. That's what I did. That's what Governor Riley did. We go outside of our community and we come back and we provide our community service and to have a better quality of life for our children, to provide a better quality of life for the ones that are unborn. Hundreds of years ago, our ancestors prayed for the unborn. Well, here we are today. And we're fighting for those people. Not for me, not for anybody else. The water rights is important. The fentanyl crisis are important. The trust obligations to help us succeed as a small tribal nation. We need that help. We're not asking for a handout, but we're asking for that true trust responsibility so we can move together. Like a nation should move together. Nation to nation. That's what collaborating is all about. The protection of our sacred sites, the protection of Chaco Canyon, the protection of all our traditional ways of life that we still have ties to this day. Those need to be protected. Those need to be, and we need that protection from the federal government. We can't do it alone. And those ties have been dwelled in us in our language, our songs, our prayers, and our ways of life. And we have to continue that. For Santa Clara, we're an extinct creature now. There's not very many of us left. There's not many of us that speak our language. We're blessed to have our children from early childhood to 6th grade, that we implement math, science, reading, health, all in our language now, not only in the table language, but in the Western
Yep.
society, you know, and then from there on, they disperse to different public schools throughout New Mexico. But that's the core, that's the key that's gonna keep us together. We need that federal assistance. We need that help.
I appreciate it, James. That, uh, very passionate about it, and I appreciate that, and I appreciate your testimony, and thanks for being here today.
Thank you.
Uh, Charles?
Mama Guazi Hopa, Yamatapo Come, Situjin Katani Training, Gigi Timotis, Kata Pamma, and Wetsi Ashton, Skawis, Kayu, Skayus Team, Shitun, Asha Chasi, Scotran, Tawa Hopa, Wetsi, Stroyash. Tawa. Thank you very much, Chairman Simpson, Ranking Member Pingree, and members of the subcommittee. I greeted you also in our Karis language, asking you how your day was, and I hope that you, your loved ones, and all your relations are in good health this morning or this afternoon. My name is Charles Riley. I'm the governor of the Pueblo of Acoma in New Mexico. In my written testimony, I set forth specific recommendations and requests, but at this time, I would like to speak more broadly and welcome any questions. First, the Acoma people are an ancient people. Acoma Sky City, the original name is Hauku, which means a place prepared, has been our mesa top home for over 1,000 years, making it one of the oldest continuously habited communities in the United States. As represented in the canes we carry given to us by Abraham Lincoln, we share a unique government-to-government relationship with the United States. The Lincoln canes were specifically presented to every Pueblo governor over 150 years ago to acknowledge our sovereign authority over our lands and our people. This cane is a physical embodiment of the recognition of our status and of the commitment of the United States to protect and respect our sovereign rights, as well as to support the well-being of our communities pursuant to federal trust responsibilities. Like other tribes, we appreciate the subcommittees for their bipartisan efforts to protect the BIA, IHS from federal funding cuts during these recent fiscal years. Second, our water settlement has been reintroduced, and we ask this subcommittee to support full funding for Indian water settlements, which promote economic development and water security for our future. Third, in 2020, President Trump assisted Acoma and other tribes in the return of ancestral human remains and associated funerary objects from Finland. President Trump also played an integral role in supporting the Safeguard Tribal Objects of Patrimony Act, or commonly known as the STOP Act, which Congress passed, and we asked this subcommittee support in urging this administration to issue regulations that were mandated by the STOP Act but were never promulgated. In addition, we asked this subcommittee to provide additional funding for the support of the Native American Graves Protection and Repatriation Act, as well as funding for the implementation of the STOP Act, and additional funds for tribal historic preservation offices. These funds are needed to ensure the protection of our land's most sacred and historic objects and ceremonies. Fourth, we request that this subcommittee provide funding for a resource management plan amendment and implementation of programmatic agreement for the Bureau of Land Management Farmington office. The current plan is severely outdated and does not reflect modern oil and gas technologies or techniques, and an update is needed to ensure protection of our cultural sites around Chaco Canyon. A programmatic agreement is needed to ensure the agency's Natural Historic Preservation Act obligations are met in a streamlined yet compliant manner. Fifth, we ask this subcommittee to dedicate IHS maintenance and improvement and other facility construction funding to the Hauku Health Center to offset significant repairs needed for this facility to become operational. Last year, during this subcommittee hearing, I informed the subcommittee that Acoma was essentially forced to take over the healthcare system there because of lack of services, lack of personnel, and it came to the point where we just finally said, we have to do this for the well-being of our citizens here at Acoma. The Pueblo assumed control of the IH facility in October of last year and was forced to spend its own funds and make critically needed repairs. As an example, due to chronic underfunding, the facility lacked hot water in a hospital. Plumbing issues, deterioration of the structure. We were not allowed to enter the facility till they actually turned the keys over, so we didn't know what we were walking into. We just knew we had to take it over. That is why we were asking for some funding dedicated to the Haku Health Center, so that we can rebuild and move forward and improve our healthcare system for our people. Finally, the Pueblo strongly urges Congress to increase funding to properly staff the BIE, Bureau of Indian Education, and the Indian Health Service. These agencies and their respective employees are instrumental for the United States to honor its unique trust responsibilities and obligations to the Pueblo and other tribal nations. While the Pueblo does not oppose establishing an efficient federal workforce, federal policies aimed at reducing the federal workforce have constrained the capacity and the effectiveness of federal officers serving tribal nations. The Pueblo has experienced significant delays from federal offices in fulfilling its responsibilities and obligations, caused, at least in part, by reductions in federal staff and resulting in overbearing workload placed on remaining federal employees. For example, the Pueblo has waited years for the BIA to place land use to trust, which has upheld efforts between the Pueblo and the Bureau of Land Management to effectuate a land exchange to reroute the Continental Divide Trail to the El Malpai Visitor Center and the City of Grants, which would enhance public safety and promote tourism. Further, the Haku Health Center is a vital source of healthcare to the local community, but does not receive adequate funding to fully staff physicians, nurses, and other key positions. That concludes my testimony. Thank you for your time. More topics and more details can be found in my written testimony, and I'm happy to answer any questions. I also extend an open invitation to members of the subcommittee and your colleagues to visit Acoma. I would be more than happy to host all of you whenever you'd come out, and I really do encourage you to come see the other side, where we as Pueblo people have a very unique landscape and a unique form of government.
Thank you. Thank you both for being here and stuff. You raise a bunch of issues that are important, both obviously to you, but to this committee also. Drugs that you talked about, it's a huge problem on reservations across this country. And the reason that these cartels, or whatever you want to call them, go to reservations is because we don't have adequate law enforcement in those places to patrol whole reservation. And they know they're less likely to get caught in those places. Consequently, we find this all over Indian reservations all across this country, and it's something we got to address. But that gets back to law enforcement and getting adequate law enforcement. We did increase or reestablish, I guess, the opioid reduction task force that was established during the previous Trump administration. And from what I understand, and talking to the secretary then, Zinke, that was secretary when they put it in, it was moving in the right direction and getting some results. And then for some reason, it just got passed over, and we reestablished it last year. I think that's a good first step, but it's not adequate enough to address the whole problem that we've got to deal with. You mentioned the water settlements. We talked about this a little bit just before our lunch break. I will tell you that it's going to eat this budget alive if we don't find a way to pay for these. And I'm not against the settlements or anything, but if we take them out of the budget that we currently have, I mean, we're talking billions of dollars is what these settlements, when you look at all of them across the country and stuff. Some way we got to find a way to fund these things. And we're searching. I happen to think they ought to come out of the Justice Fund, but that's not what it does right now. We have to appropriate money for it. And of course, if we appropriate money for that, then something else gets cut down the road. So we gotta find a way to fund these water settlements, because I think they're important that we do that. But it is a challenge for sure.
And I completely understand, Chairman Simpson. In the case of Acoma, we've negotiated our water settlement, and we were just trying to get it, it's been reintroduced, trying to get it passed.
Yep.
In Acoma's case, the water settlement addresses our needs for the future because of the mining that has taken place in and around Acoma. Along Mount Taylor, it has depleted our water source that we relied on for a millennia. The flow in the Rio San Jose historically ran about 14 to 15 CFS, which is not a lot compared to a lot of the other rivers and waterways in the United States. Today, it runs about 1.5 CFS
Mm.
because of the depletion of the
Yeah.
groundwater. In our water settlement, we're not, in New Mexico and in the Acoma region especially, it is such a water short basin that the only way that we can guarantee water for the future of our community and surrounding communities is through the settlement. We would have to pipe water from another water basin into our basin in order to sustain our community, and that is the only way we're going to be able to do it. However, if we don't get this water settlement done and get those projects going, the mining companies are also planning to tap into that too. So now the only untapped, uncontaminated source of water that we have is in danger.
Yep.
And that's why we're so adamant about trying to get these water settlements completed and get the money and make sure that our community has water into the future.
Yep. Believe me, I'm fully sympathetic with the problem that you face, and I went up and visited the Belknap tribes and stuff, and they have the same water settlement issue up there, trying to get funded and stuff. Same reason, because they're not going to have water. They're not going to have portable water, and so it is a challenge all across this, but we got to find a way to do it. And like I say, I'm not against the settlements. My attorney general called our state, my state director the other day, or I guess my chief of staff, and said, "Hey, we just came into settlement with the Coeur d'Alene tribe."
For Santa Clara.
And she said to the attorney general, "What do you need?" And she says, "Well, we just need the funding." And she said, "How much you looking for?" And he said, 600 million. Oh, okay. Where are you going to find that in our budget? So I understand what you're saying. I agree with you. It's a matter of, we got to find a better way to pay for this so that it doesn't eat up everything else in the budget.
What's troubling is that the state or the federal government settled with the Acequias, the non-Indians, but yet in the Abbott case, we're trying to settle our negotiations.
Yeah.
And the state want us to regionalize, but that doesn't work for the tribe. That doesn't work for us.
Yeah.
And so we bring solutions to the table, but nobody wants to. They want us to follow their formula.
Yeah.
But that formula doesn't work for us.
I know.
You know what I'm saying? But yet, when it's a settlement for Santa Clara Pueblo and not anybody else, but they think it's about them. But
Yep.
those settlements have already been gone. They already had their opportunity. This is our only one chance. We only have one chance at this.
It's like, it's easy if you are trying to divide up water and your assessment is that there's more water than there really is. And that's happened throughout the West. We've over appropriated
Right.
a lot of
Yeah.
rivers and that kind of stuff. I was telling somebody earlier that when they did the Colorado River Basin, they created the upper basin and the lower basin, they assumed that there was 18.5 million acre feet of water that ran down the river every year. And somebody told them at the time, this is in the 20s, that no, you're looking at only the wet years. When you add in the dry years, it's actually about 14.5 million acre feet that run down. So they've over appropriated by a ton of water. And now look what you've got going on in the Colorado Basin. So it's a challenge for all of us.
And part of the problem is that the irrigation system runs through our property without proper easement.
Yeah.
But yet they want us to maintain, they want us to maintain the acequias at whose cost?
Yeah.
At our cost, but yet there's not even no written agreements from the non-Indian users. And it seems like people think like they own the water. The water belongs to all of us, you know, and that's our goal, is to be good neighbors, to share the water properly
Yeah.
for everybody. But
The
but
problem
people don't
is
understand that.
on the East Coast, they have riparian water rights because they're trying to get rid of water. They got so much water. We have prior appropriation water rights in the West because we're trying to save every drop because we live in a desert,
Right.
essentially, you know?
Mhm.
It's a challenge. Ms. Pingree.
I'm good. I'm gonna just leave you not answering any more questions, but I really appreciated your testimony and I learned a lot from the many things you brought up. So thank you both for being here. Appreciate it very much.
Thanks for having us.
Thank you.
Thank
for
you.
having us.
And I do want to get out and see
Come out.
your area and stuff because it is beautiful country and I haven't been there. I want to go see them. So,
Got good food out there too. We got good chili out there.
yeah, I know it.
Just need water to grow it.
That's right. Thank you for being here today. We appreciate it
No,
very much.
Thank you.
Verlin? And Buu Nygren, yeah. I was gonna say it. Hi, Boo. How you doing? Verlin, you're first.
Right, it's on. Good touch. What's it gonna be? Good afternoon, Chairman Simpson, Ranking Member Pingree, and distinguished members of the subcommittee. I am Berlin Jose, Chairman of the Navajo Nation. I appreciate your dedication to Indian country and welcome the opportunity to testify today. First, respectfully, I ask that you prioritize funding for our roads. There are more than 700 miles of BIA roads on our reservation, and most are dangerous for motorists, including emergency response vehicles, school buses, families, federal personnel. Monsoon flooding can last for months at a time and can completely wash out our roads, stranding members and isolating entire communities from access to essential services. The BIA Road Maintenance Program has been underfunded for years and has a deferred backlog of over $400 million. More funding must be provided for BIA Roads program in FY 2027. Next, I will address the need for water settlement funding. The nation was one of the first tribes to enter into a federally approved water rights settlement, and we are in negotiations to settle our remaining claims. Unfortunately, our water settlement has never been fully implemented because of chronic underfunding. Current Colorado River conditions threaten our entitlement. Annual funding must be made available or the nation and other tribes will never receive full measure of our promised water rights. Federal funding is desperately needed to address our unique public safety challenges. The nation shares a 62-mile border with Mexico, and we work closely with Border Patrol and other law enforcement agencies. We spend our own funds to assist with border security efforts. We would appreciate more federal financial resources to support our efforts. The nation's police are often the first and only responders to criminal activity. But our police work out of a converted 1950s BIA jail that is not equipped to handle modern law enforcement responsibilities. Our detention center is in poor condition. Interior's Office of Inspector General highlighted serious health and safety concerns at the detention facility 3 years ago that have not yet been fully addressed. In 2024, BIA estimated that the unmet need for public safety programs in Indian country was over $3 billion. This is a real public safety crisis. Congress must provide funding to meet this critical need. Greater federal investments is needed for our failing Indian health service facilities. The current IHS deferred maintenance backlog is nearly $1.5 billion. The nation's 60-year-old hospital in Sells, Arizona, is one of the oldest IHS facilities, and it can only handle minor medical issues. A replacement facility has been on the IHS facilities priority list for over 30 years, and yet it continues to receive only limited funding allocations. Congress must appropriate more funding to complete the healthcare facilities on the list in a reasonable timeframe. In August of 2020, the aging Phoenix Indian Medical Center was forced to close its labor and delivery services. Those services have yet to resume. Congress must do better to fulfill the trust obligation to provide health care to Native Americans. Finally, more funding for Bureau of Indian Education facilities. Construction is critical. BIE has identified 2 of our schools on its list of facilities in poor conditions. One of those, the Santa Rosa Ranch School, was forced to close in 2018 due to significant safety issues and still has not been replaced. The Santa Rosa Day School, another school on our reservation, is slated for replacement by BIE, but will not be funded until 2028. The poor conditions at BIE schools have been documented for decades. We urge you to provide adequate funding to ensure BIE schools can be renovated and replaced sooner so that Native children have a safe and modern and supportive learning environment. We also submitted our written comments in more detail. Thank you for your time. I'm happy to answer any questions.
Thank you, Vernon. Appreciate it. Doc?
Yate, Chairman Simpson, Ranking Member Pengree, and the committee as well, and your staff. My name is Dr. Buu Nygren, Navajo Nation President. Thank you for the opportunity to testify again before this honorable committee on behalf of the Navajo Nation's fiscal year 27 federal budget priorities and priorities in general in Indian country. Many of the items I will testify are rooted in our Treaty of 1868, and it is in that spirit of treaty and our government-to-government relationship that we continue to support the Navajo Nation's support for advance appropriations for IHS. Advance appropriations provide stability and continuity for essential health services that we've been enjoying the past couple of years, which allows us to better plan and efficiently utilize our funding. So we continue to urge Congress not only to continue these advance appropriations beyond fiscal year 27, but also to expand them to key programs within the BIA and the BIE to move toward mandatory funding for these core responsibilities. We urge support for advance appropriations to these agencies. Also, despite federal trust obligations, the federal investment remains far below of what is needed. Federal spending on the IHS is around $4,000 per person annually, which is less than half of what the federal government spends for other major federal health programs like the prison system and the military. The closing this gap is essential for improving the health and lowering overall costs created by preventable health issues. We remain frustrated by the funds. Also, we remain frustrated for the funds that were taken from the Gallup Indian Medical Center late last year. The GMIC is the oldest and the largest IHS facility in the country and is in dire need of a rebuild. While I appreciate the Honorable Secretary Kennedy's attention to this issue, including HHS's visit last week on Friday, we still need to find a way to get the $60 million that was transferred from this rebuild so we can continue to stay on track to get this project back on track. Education funding also must be strengthened. The BIE faces a $1 billion deferred maintenance backlog, an estimated $6 billion shortfall in all Indian country school replacements and construction needs, and severe staffing shortages for the 180 plus schools. We continue to urge Congress to increase funding for the Indian School Equalization Program by at least $400 million and fully fund school safety initiatives, including for school resource officers, Additionally, Congress must ensure that the BIE has additional funds to accommodate its assumption of the Department of Education's tribal programs. Funding delays or losses are unacceptable. Moving on to our public safety, our police department operates with roughly one officer for every 1,000 residents, or about 1/4 of what is recommended. Our officers respond to more than 200,000 calls for services each year across various distances ranging from 1 hour to 3 hours. 2 of our major public safety facilities were condemned in 2019 and have yet to be replaced, forcing officers and courts to operate out of temporary spaces. The BIA estimates that public safety needs in Indian country total $3.1 billion annually, yet current funding levels are less than $450 million. There is a substantial probate backlog in Indian country as well. And I also applaud Secretary Burgum, the Honorable Burgum, for making it a priority to resolve it. The BIE needs more assistance in its digitization probate efforts to help reduce this backlog. It is essential that on the Navajo Nation alone, there are tens of millions of dollars in assets in the probate backlog. Those assets should be with our people, and we request that Congress work with the BIA to identify what the full scope of needs, including providing more funding for our 638 contracts for vital records. We also urge Congress to strengthen funding for programs that protect Native children and families. The ICWA program is severely underfunded, leaving the Navajo Nation with $6 million in shortfalls in our ICWA program. We support full funding of $46 million for ICWA nationwide. We also request $60 million for programs under the Indian Child Protection and Family Violence Prevention Act to help address child abuse, neglect, and family violence in tribal communities across the country. The Navajo Nation's emergency medical services system, which responds to nearly 22,000 calls last year, continues to face severe funding shortages. Dedicated federal funding for tribal EMS is direly needed. Lastly, the Office of the Navajo and Hopi Indian Relocation Window. Relocation is winding down its operations, even though by our estimates, at least 40 families have yet to still receive homes, and other federal promises have not been kept. While ONEIR was notoriously mismanaged, the BIA, which has taken ONEIR's functions, which has been active and communicative partner, I urge you to maintain sufficient funding for ONEIR's obligations so that this closeout process is not rushed and can be properly and humanely carried out. Thank you again for this opportunity and for honoring the treaties between our nations. And I look forward to the discussions that we're going to have here today. So, yeah.
Thank you. Thank you both for being here and for your testimony. You started talking about roads. It's a problem. We don't fund roads here much anyway. That most of them comes out of the transportation subcommittee and stuff. But I know Chairman Cole, when he chaired that committee, was looking at how the funding that went to Indian roads had essentially remained constant while the others had gone up. So he kind of reversed that. But I was reminded of when we visited the Navajo Nation out there. There was me and Betty McCullum and several of us, and they took us out to see a school. It's, I think, since been replaced, hopefully. But they put us on a van. We drove out there, dirt road. I at the time had a Fitbit. Count your steps. Betty and I were competing with each other, riding in the van. I got 20,000 steps just riding in the van out to the school. That's how bad the road was. That's when I realized, yeah, they do need some roads. In fact, you would destroy your van if you drove that out here every day. But anyway, it is a challenge. But I appreciate you bringing the issues up to us. I know that we're trying to close out the relocation program and stuff. It is what we put $7 million in to support the closure of in last year's bill to support the closure of it and stuff. It's something that we've been trying to do for a long time. Some of these programs have got to end so that we can get other things done. But you're right, we got to do it in the right way. So I appreciate your testimony.
Yeah.
Thank you, Chairman Simpson. And I know you're talking about water rights all day long, and it is important because water is life, you know. And the Creator has placed all us tribal nations on where we are, where we've lived from time immemorial. It's, I think, the encroachments of the more greater good of humanity that continue to drain our aquifers and so forth, and left us in between a rock and a hard place, literally. Thank you for your time. We appreciate it.
Yeah, it is just in Idaho. I mean, not the Indian water settlement issues and stuff, but you know what's happening in the West this year. There's no water. I mean, normally I would have 3 or 4 feet of snow in my backyard and none. I live on a golf course. They were playing golf year round, Christmas Day. That's unheard of. And consequently, there's going to be some real problems this year with water. And then you throw on top of that, the wildfires that are going to come. I was at a wildfire conference last week, and I'll tell you, it's going to get ugly, I think. We got to be very cognizant of that. But water is a huge issue. That's where the old saying comes from. Whiskey's for drinking, water's for fighting.
Thank you.
Ms. Pingree?
Yeah, thank you both for your testimony. I really appreciate all you had to say. And you're right, we've been hearing about a lot of water settlements today, and we really do need to have a big infusion of cash because you put it well. You were there first, and now this water's not available, and it's obviously essential to the future of your communities. And just thank you for going over so many different areas between the roads and the law enforcement, schools, health. I'm just going to hope that we have a decent allocation in our budget this year and we can help to bump up some of those accounts because I know you're operating with just completely inadequate numbers and you take care of a lot of people in your communities and we want to do whatever we can to help you. So thank you so much for being here and for the example that you set.
Thank you. We have
Thank you.
37,000, 2.8 million acres of land.
Wow,
Yeah.
it's a lot of territory.
Well, if we don't have a decent allocation this year, you can blame Shelley because she never calls the chairman. And no, I'm just kidding. Yeah, she does. That's right. Anyway, thank you.
Thank you.
Appreciate it. Francis Creever, AC Locklear, Abigail Echohawk, Conrad Jacket. Okay, I've got Francis first.
Good afternoon. Oh, thank you. That's right. Good afternoon. My name is Frances Crevier. I'm Algonquin and I'm the CEO for the National Council of Urban Indian Health, a national representative for the 41 urban Indian organizations or UIOs contracting with the Indian Health Service under the Indian Healthcare Improvement Act. I'm testifying today in place of Robin Sunday Allen, who is our board president-elect and the CEO for the Oklahoma City Indian Clinic, an urban Indian organization that provides comprehensive health care to over 26,000 tribal patients, representing over 220 federally recognized tribes. Robin was unable to be here today due to the weather canceling her flight, so I will now read her prepared testimony. So thank you, Chairman Simpson, Ranking Member Pingree, and members of the subcommittee for the opportunity to testify today and to your leadership to preserve and protect the Indian Health Service. This committee understands the federal government's trust obligation to provide health care to Native people no matter where they live. UIOs are an integral part of the Indian health system, and they provide high-quality health care to tribal members living in our urban areas. The Oklahoma City Indian Clinic provides robust outpatient services from birth to end of life and is an essential part of the Indian health system in assisting the federal government in fulfilling its trust responsibility to Native people. The Indian health system is deeply personal to me. I was born in an Indian hospital and I received my healthcare from a tribal Indian health service or urban facility my entire life. I was the recipient of an Indian Health Service scholarship. That scholarship put me through to the University of Oklahoma College of Nursing, in which I graduated. And then I became the Oklahoma City Indian Clinic. I went back as the registered nurse and I never left. That was 30 years ago. What kept me here was simple. I saw what this clinic could become and I wanted our patients to have a better experience than the one I had growing up. Not because the system was broken, but because I knew it could be so much more. My personal experience coupled with my professional experience has fueled my passion for ensuring we deliver the highest quality healthcare to Native people. The vision of the Oklahoma City Indian Clinic is to be the national model for American Indian healthcare. We've adopted the congressionally established Malcolm Baldrige standards of performance excellence and have twice received the Oklahoma State Award for Performance Excellence from Oklahoma Quality Foundation. Our commitment to excellence shows in how we deploy our resources. Roughly half of every dollar we spend goes directly to preventative care. When you look at our top 10 diagnoses, 6 out of the 10 are preventative care diagnoses. That is what's responsible stewardship of federal funding looks like, and it's exactly why an increased investment in urban Indian health pays off. As you know, IHS has been chronically underfunded, and I want to reiterate the request of tribal leaders in calling for IHS and urban Indian health line item to be fully funded and to maintain advanced appropriations. These are not new asks, they're overdue asks, and our funding must be protected from any cuts, sequestration, and freezes. Historically, disruptions in funding to the Indian health system have resulted in a loss of life. However, with the IHS receiving advanced appropriations, funding was able to flow to UIOs without delay during last year's government shutdown, ensuring that our services were maintained for our community. We ask that IHS receive mandatory and full funding, and increased funding will enable our healthcare system to recruit and retain quality professionals and allowing us to meet the growing demand for services in our community. In Oklahoma, we are seeing alarming rises in cancer rates, and to me, cancer has become what I refer to as the new diabetes of Indian country. It is ravaging our community like diabetes has done. At the Oklahoma City Indian Clinic, we are diagnosing over 20 new cancer patients each month. We have hired a full-time oncology nurse, case manager, and a part-time oncologist. This is why funding for our health programs, as well as initiatives like the Native American Cancer Outcomes Program, is more critical than ever. In addition to the rise in cancer, we are also seeing a growing behavioral health crisis in our community. We have seen a significant increase in the number of patients presenting with anxiety and depression. And what concerns me most is how much of that we are seeing in young people. A clinic is not traditionally where you would expect to find robust behavioral health services, but our patients need them and they are coming to us. We're putting resources where we can to meet that need, but the demand is outpacing what we are able to provide without dedicated, stable funding. This is why SAMHSA programs like Native Connections, which help us address Native youth suicide, must be well funded and protected. We also request that UIOs be included in future funding in the behavioral health pilot program that was established this year. Thank you again for the opportunity to testify. We stand by as a resource to support the federal government as you continue to work towards the obligation to provide health care to American Indians and Alaska Natives. We urge Congress to take this obligation seriously and provide UIOs and IHS with all the resources necessary to protect the lives of the entirety of the Native population. You can ensure that American Indian health care isn't just available, but that it is the very best health care. Thank you so much for your time.
Thank you, Francis. AC, you're next.
Thank you, Chairman Simpson, Ranking Member Pingree, and distinguished members of the subcommittee. Thank you for this opportunity to testify on behalf of the National Indian Health Board and the 575 federally recognized tribal nations we serve. I'm honored to provide testimony on fiscal year 2027 appropriations for the Indian Health Service. My name is AC Locklear. I'm a member of the Lumbee Tribe of North Carolina, and I have the honor of serving as the Chief Executive Officer of NIHB, the only national tribally led organization dedicated to advancing the health of all tribal nations. Firstly, thank you for your leadership in providing advanced appropriations for IHS. During last year's 43-day shutdown, every IHS facility remained open, every patient received care without delay, and every employee was paid. That stability was only possible because of advanced appropriation, and it reflects this subcommittee's longstanding commitment to tribal health. For decades, Congress has provided steady support for IHS through incremental funding increases, and we are grateful, but incremental progress is no longer enough. More substantive investment is needed to address workforce shortages, to modernize infrastructure, and to strengthen care delivery across the system. Through the subcommittee's bipartisan leadership, along with recent actions by the administration, we now have a once-in-a-generation opportunity to move beyond incremental progress and build a health system that is modern, culturally grounded, and capable of delivering the level of care tribal nations deserve. For FY27, NIHB supports the National Tribal Budget Formulation Work Group's recommendation to fund IHS as a mandatory program at $73 billion, including the services, facilities, and improvements necessary to bring Indian health system to the same standards as the broader U.S. healthcare system. The need for modern facilities is extraordinarily pressing. IHS estimates more than $26 billion is required to address facilities construction needs. At current funding levels, that would take over 200 years. We are, however, encouraged by Secretary Kennedy's recent announcement to direct $1 billion in funding towards healthcare facilities construction to begin addressing the long-standing 1993 backlog. This is an important step forward, but requires the partnership of Congress to make this true progress. But the magnitude of the need requires sustained investment, not only in healthcare facilities construction, but also in tribal sanitation facilities construction and facilities maintenance and improvement. At the same time, workforce shortages are also an urgent challenge facing the Indian health system. For the past decade, IHS's vacancy rate has hovered between 20 and 30%, leaving tribal communities without providers, facilities without administrators, critical services delayed, reimbursement claims unpaid. We appreciate the administration's newly announced hiring initiative and now urge Congress to provide resources necessary to sustain and expand those efforts. Programs like purchase referred care also remain underfunded and understaffed, forcing tribal nations to delay or deny access to specialty care, an outcome that's both preventable and unacceptable. Modernization of the IHS must also include critical investment in health information technology. NIHB requests that Congress fully fund the implementation of a modern electronic health records or EHR system. Recent federal estimates place the total cost of EHR modernization at approximately $6.2 billion, reflecting the full scope of implementation, including support for tribal nations that have already invested their own systems to upgrade, integrate, and securely connect. This is more than just technology. It's about protecting sensitive data in an increasingly vulnerable system and building infrastructure that is secure, interoperable, and grounded in tribal data sovereignty. Together, this offers us an unprecedented opportunity to finally modernize the Indian health system. If we get this right, the impact will be profound, improving care coordination, strengthening clinical decision-making, and ultimately leading to better health outcomes across Indian country. However, we recognize the growing contract support costs in Section 105L lease obligations and the limitation of the committee's 302B allocation continue to constrain investments in other critical priority areas. Until Congress moves these accounts to mandatory, we do request heightened support for the remaining IHS line items to ensure that tribal health programs have the resources needed to sustain essential services and meet the growing healthcare needs across Indian country. Behind each of these investments are real patients, families who rely on the system for care that they cannot access anywhere else. Thank you again for your leadership. With continued partnership from you, your colleagues across the House, engagement from the administration, and the leadership of tribal nations, we have a real opportunity to move beyond incremental progress and to modernize the Indian health system, ensuring the federal government fully meets its trust and treaty responsibilities. NIHB looks forward to working with the subcommittee on these priorities in our testimony. Thank you.
Thank you, AC. Appreciate that. Abigail, you're next.
Hello. Thank you so much, Chair Simpson, Ranking Member Pingree, distinguished members of the committee, and to the staff who put this all together and got us all here. We're so appreciative of all the work that you're doing. I want to share a story with you. Several months ago, I had a knock on my door at my office as the Executive Vice President of Seattle Indian Health Board. I'm a citizen of the Pawnee Nation of Oklahoma, and I'm blessed to work in an urban Indian health program funded by the Indian Health Service, in addition to the director of the Urban Indian Health Institute, one of the nation's 12 tribal epidemiology centers, but with a focus on urban Indians. That knock on my door, when I opened it, I saw a member of my staff looking very distressed. She let me know, she said, Abigail, we have a situation. Our elders program, which is one that I oversee, she said, there is an elder who just let us know that she has recently been raped, and her perpetrator is in the building in the program with us right now. My team sprung into action. We ensured that this woman, 80 years old, in a wheelchair, we ensured that when she asked for new clothes, that we went and sorted through sweatpants. And at the time, because of a lack of funding, we only had size 5X for a small, dainty little elder. I remember pulling the string of those 5X sweatpants to make sure when we brought them to her, we could slide them up her legs and tie them tightly around her waist so after a rape, she could wear clean clothes. We brought her into a room where I called our clinical social worker, our traditional Indian medicine practitioner, and our elders. Our community came together as fully well-trained staff focused on the cultural needs of this individual and the medical needs of this individual. As she sat there and I held her hands and the tears ran down her face, creasing through the wrinkles, she told me, she said, "Abigail, I don't want to make trouble, but I don't want anybody else to get hurt." She allowed me to call 911. I called 911 and I left her with my capable staff trained by our programs that we self-fund, because with the workforce shortages in Indian Health Service and the lack of workforce development funding, we invest more than $500,000 of our own dollars to ensure my staff could respond in a moment like this. In that moment, when I called 911 and I said, "Hey, I have a rape victim here. She's 80 years old. She's in a wheelchair. She is receiving hospice care. She has been raped and her perpetrator is in the building." I hung up. I expected a police response. I waited 15 minutes, 30 minutes, 45 minutes, an hour and 15 minutes with no response from the police. The response that was happening was in that room with those culturally attuned care providers, the facility that we have worked so hard to build up to ensure those services exist. And without them, this woman would have never seen any kind of love, compassion, and she's never going to see justice. When they finally showed up, I'll leave that to the side because that's not what matters. It's 4 hours later. We put her in a taxi cab with all of the resources that she needs, and we continue to follow up. The work of Urban Indian Health Programs, Indian Health Service is this: that $73 billion is investments in ensuring the care, the health, and the well-being. And I don't care if you're 80 years old or 8 minutes old. We provide that care and all in between. And without the full funding of the Indian Health Service, you're going to see providers like myself, other people taking 5X sweatpants and attempting to pull the string so we can just fit them up the legs of a rape victim. That is something that shouldn't be happening and yet happens too often. Our tribal epidemiology centers, which I am blessed to direct, we have led in working and ensuring that we get the resources for our missing and murdered, those who have been sexually assaulted. And over the last several years, I've sat in front of you and I feel like I tell you the same stories, all in the same line. And in fact, last year I told you the story of a dementia survivor who had been beaten and strangled so many times that she was suffering memory loss in her early 30s. And we couldn't give her resources or services because our dementia funds, those funds from IHS, are only for people over the age of 50. And so we looked, we searched, I connected after I spoke with all of you, and we couldn't get the resources or help, so we're doing it ourselves. We have launched the very first survey to find out the incidence of traumatic brain injury for sexual assault, domestic violence, and trafficking survivors, and there is no money for it. And in fact, I'm partnering with local Native Hawaiians in Hawaii because they have the same issues. And I was sitting with a mother of a young woman who had been brutally murdered in the military. Her husband was active duty military in Oahu. She was 19 years old, Native Hawaiian and Blackfeet. He murdered her, dismembered her, and then burnt her. And when he was prosecuted, and this is what Auntie Frances, she wanted me to share this with you all, and I'll end with this. She told me, she was grasping onto my arm, and she said, "Abigail, when you go to Congress next time, tell them there has to be accountability. Tell them to care as much as I did for my daughter who laughed so much, who was so loved. Tell them that there has been change, but we need more. And the full funding of the Indian Health is essential to that at the full $73 billion, and ensuring that the tribal epidemiology centers and the work that my team and I, in addition to the other epicenters do, are essential to the health and well-being of our communities." That woman, as she held my hand with the tears streaking down her face, Auntie Frances, and the story I told you in the beginning of the rape victim, they said the same thing. I'm only doing this and I'm only sharing my story so no one else has to. Thank you.
Conrad? Yeah, just grab that one.
Wow, that's pretty hard to follow up right there. I really wish you guys can take that in consideration, because that's a strong testimony right there, Ms. Echohawk. I very much appreciate that, coming straight from the heart. Thank you. Do I? Good afternoon, Chairman Simpson, Ranking Member Pingree, and respected members of the committee. I'm Connor Jackett. I serve on the governing body of the Albuquerque Indian Health Board. I'm from the Imanu tribe. I'm also an elected member of my tribal council. Thank you for inviting me to speak, and thank you for your continued dedication and hard work to support Indian country. We have submitted written testimony that details our federal funding needs for fiscal year 2027. AAIHB is a consortium of several federally recognized tribes in New Mexico, southern Colorado, and eastern Utah. We consist of the 2 bands of Navajo, Tahajale, Rama, the 2 Apache tribes, Mescalero and Jicarilla, and the 2 Ute tribes, Southern Ute and Ute Mountain. We also provide healthcare services to citizens and other tribes throughout New Mexico, southern Colorado, Utah, West Texas. Our tribal organization is entirely funded with federal dollars. About a third of our funding comes from IHS. As we all know and have heard from tribal leaders, IHS has been underfunded for years. Although we appreciate the committee's efforts to protect and preserve IHS funding, we ask that Congress find new ways to increase IHS funding. At the very least, we urge you to ensure that IHS funding is increased to keep pace with inflation. We greatly appreciate Senator Kennedy's strong support for IHS. Today, I'm here to tell Congress that without increase to the 2027 budget, healthcare programs throughout Indian country will face across the board cuts. This is due to the rising cost from medical inflation, as well as more and more patients using IHS or tribally contracted clinics. Our existing funding is simply not enough to cover our current programs, let alone absorb more cost. For example, my organization has contracted some services from the IHS on behalf of our member tribes, including ideology. We are the only provider of hearing services for many of our rural tribal communities, which includes elders, veterans, and children. We ask that Congress increase IHS funding so that we can continue to provide essential healthcare services that Indian country relies on. We also ask that Congress continue to protect, preserve, advance appropriations for IHS. We thank you for repeatedly serving advance appropriations. This area of bipartisan agreement will allow us to provide stability for our staff and patients. We ask that Congress continue to provide advance appropriations going forward. As the administration carries out realignment efforts within IHS, we strongly urge this committee and Congress to ensure that funding for IHS remains a priority. We ask that this committee ask to ensure that IHS programs are fully funded. In particular, we ask for fully funding for the Division of Epidemiology and the Center Prevention, Tribal Epidemiology Centers, Special Diabetes Programs for Indian Communities Health Representatives, Division of Behavioral Health, Injury Prevention, and the HIV, HCV, STI program. These programs provide critical services and are very valuable to tribes and tribal organizations throughout the nation. Put simply, these programs save lives. Lastly, we recognize Medicaid is not directly under you guys. We ask that the members of this community continue to fund Medicaid with expanded coverage for American Indians and Alaska Natives. This provides additional and much needed resources to not only IHS beneficiaries, but also for our tribally run and operated healthcare programs. Before I conclude my testimony, I'd like to say on behalf of AIHB, Albuquerque Indian Health Board, we are very thankful for you to continue your hard work that this committee does year after year to help promote and for the safety and health of Indian country. We urge the committee to continue that work by safeguarding and finding ways to increase the federal funding that Indian country relies on. We truly appreciate this committee's hard work, and I would very happily be grateful to answer any questions. Thank you.
Thank you, Conrad. Thank you all for being here today. I know that if you've listened to any of the members or any of the testimony, the advanced appropriation was a huge step forward, but it was only a step forward. We would all like to, I think, get mandatory funding for Indian Health Service. I said this morning that I think it's the only health service program in the federal government that isn't mandatory funding. And Tom Cole was sitting here and he said, and it was the first one. And it's the only one that's not mandatory funding. So we're still working on that, trying to figure out exactly, because first question I ask is, so how do you make it mandatory? And it's not a simple process, but it's something that we got to continue to work on and get it. But obviously last year during the shutdown, it was obvious how important that advanced appropriation was. And again, I'll tell you, I think you were the chairman, weren't you, Shelley, when we did that? Yeah. And so a lot of credit goes to her. A lot of people worked on it, but she was the chairman at the time. So she deserves a lot of credit for pushing that and stuff. But thank you for all you do. And thank you for your testimony today. And Abigail, I just wish you could get a little passion for these issues, you know?
I try.
You do a great job. Thank you.
Thank you.
Yeah, thank you.
Shelley?
Thank you all for being here. You do some of the most important work in Indian country, and thank you for that. And you are a brilliant storyteller, but I'm sorry about the stories you have to tell. Really, it's just so sad to hear them, and appreciate the dedication that you have and the work that you do there in Seattle, and really to all of you in the organizations that you lead and that you work with. Just so critically important. I too would like to see us get to mandatory funding, and I think it's just a travesty that we are so underfunding Indian health. And particularly when we have other government-funded health programs that do better than this. So it just is it's a bad reflection of our priorities, and we should reverse that as soon as we possibly can. And you brought up so many things that we've been talking about already today, but just, really getting the adequate funding there. Conrad, you mentioned Medicaid, and I'm worried about the cuts coming to Medicaid and how that will impact Indian country, because I know we not only are underfunding Indian health, but we depend on Medicaid supplementing the system. And I just don't know how that will impact things going forward. So I think we have to put whatever protections we can into the language of this appropriations bill about how we hold that harmless and make sure that CMS understands that this is Indian health funding. It just can't be a part of the regular Medicaid cut. Yeah, one thing that, Francis, you mentioned when you said that cancer was the new diabetes, that's deeply disturbing. I know how devastating diabetes has been to Indian country. So just give me a little bit of sense of, are there certain kinds of cancers that you're all seeing more of, or that you're referring to? We know there's a rise in cancer, but just that's really worrisome.
Yeah, so I can get information from you, from Robin from the Oklahoma City Indian Clinic, but I know that it's been significant, and there's been a lot of different issues there, and I don't know, Abigail, if you had any data on that.
Yeah, so when we look at the epidemiology of what's going on around cancer, some of it, the ones that Native people die the most of are the ones that are the most preventable. Colorectal cancer is one of the ones. I was working on a project one time where we were trying to get an education program out for people to understand what it means to get your colonoscopy, what age you do that at. But what we found is that while we could get people like a basic, like a test prior to understanding if they needed a colonoscopy, there was no funds in the tribe, nor did the Indian Health Service. It was one of the least priorities in regards to when they get to the bottom of their dollars, who gets the colonoscopy. And so despite us getting people interested in being screened, they still wouldn't have gotten a colonoscopy anyways, which is why Native people are more likely to die of colorectal cancer when it is the #1 preventable cancer. We've seen the rise of other cancers, and we can see a lot of work going on, research right now, tying it to environmental factors, particularly reservations close to nuclear plants, for example, or where there is a lot of water pollution. And so we see the impact of these extractive mines and other things that have left behind a legacy of toxins that are directly impacting. And so we're seeing this rise whether or not you're in an urban setting or whether or not you're on the reservations.
Yeah, that's deeply disturbing. Well, I hope we can spend a little more time and money following that and also get the preventative care there. But one of those things is if there's not enough healthcare dollars, preventative care is often the thing that goes first. So that's a big challenge. But again, I really appreciate you all being here today, and thank you for your work.
And I would just say, the work that Robin does in Oklahoma City and others is there's so many stories of success in Indian country. The screenings, during COVID-19, we had the highest vaccination rates. We see that even though we see diabetes increasing, we have seen more results in any other racial or ethnic group in the country in getting more of a flatline prevalence, not seeing it as shooting up as high as some other populations, even though it's still very, very bad. And I think that we need more opportunities to tell the strengths of Indian country. For example, around missing and murdered Indigenous women and girls, this was something that developed after the hearing that thank you so much for allowing me to testify in that hearing on missing and murdered Indigenous women, girls, and people, is I look towards what happened in Chicago, where the bones of an individual were found, and a cold case detective had begun to see all this stuff in the media and on, and understanding, I think our hearing probably had something to do with it too, as to where he dedicated his time. And a woman that had been missing since the early 1960s from the Yakama Nation in Washington, she was found, her bones were returned, and it was only because of the dedication of that police department, non-native, but who were beginning to see what's happening across the country. We see the implementation of Savannah's Act, the Not Invisible Act. We know that when done appropriately, these pieces of federal legislation can work, and we have success stories, but it requires success stories and continued oversight to ensure that we see the success that Indian country deserves. It's our treaty and trust. That's what we're pushing for.
Chairman, if I can add on just
Sure.
real quick. We talk about cancer and where it's coming from. I can honestly tell you, White Mesa Mill energy fields, that uranium waste facility has already contaminated one aquifer and going down to another aquifer. And you can tell from the people in that community and the surrounding community that they're being affected. So it's coming here. It's coming here with all the studies. So I just like to put that out there. Chairman.
Thank you. Thank you all for what you do, and thanks for being here today. Appreciate it very much.
Thank you.
Teresa Sanchez, Esther McCorrell, Aaron Hines, and Lendra Ross. Is that right? Leandra, okay. As you can tell, I'm not really good at pronouncing names other than like Tom or Mike.
That's okay.
Oh, I'm sorry.
Yes, you can't come up here, Hester, without a sign. No, I'm just kidding. Teresa, you're first.
Good afternoon, Chairman Simpson, Ranking Member Pingree, and members of the subcommittee. I'm Teresa Sanchez, a tribal member and representative of the Morongo Band of Mission Indians and the board president of the Riverside San Bernardino County Indian Health. I appreciate the opportunity to discuss the funding and other needs of tribal health programs in the California IHS area. Founded on the Morongo Reservation in 1968, Riverside San Bernardino County Indian Health has grown from a local effort into a major health network serving multiple tribes across Riverside and San Bernardino counties. Our evolution from a single clinic to a key provider reflects our dedication to enhancing healthcare quality and access for Native American communities in Southern California. We thank the subcommittee for allocating funds in the IHS budget for several years to help tribal health programs secure generators. These generators allow clinics to function and safely store medications during power outages caused by wildfires and emergencies, which are essential for patient care. We thank the subcommittee for directing IHS to study access to hospital and specialty care and purchase and referred care-dependent areas like California. This study will reveal challenges faced by clinics and patients due to inadequate PRC funding, underscoring the need for increased resources in underserved regions. The California IHS area lacks IHS-sponsored clinics affecting health services for tribes. Congressional action is needed to provide services equivalent to those in other areas. Tribal entities depend on loans and limited third-party revenue for clinic construction and staffing, while IHS often fails to uphold its legal trust obligation to California tribes. I request that the subcommittee include language in the Appropriations Bill authorizing IHS to build health clinics in the California area, as it has done in other areas. This is urgent for California tribes. Additionally, I urge the appropriation of federal funding to staff these facilities, given that existing tribal health programs were built with tribal resources. The California IHS area lacks IHS-sponsored hospitals, resulting in critical need for more PRC resources. Tribal health programs rely on PRC funding for specialty and non-primary care services. However, the California area receives the 6th lowest PRC funding per patient, even less than some areas with IHS hospitals. This leads to care rationing, as funds often deplete before the fiscal year ends, increasing patient risk. Boosting PRC funding for the California area would better align it with PRC-dependent regions and support essential services. The FY26 enacted PRC budget is flat funded at $996 million, with the California IHS area's share around $58 million. I urge the subcommittee to increase resources for this area to $82.9 million. The proposal would provide around $940 per Indian patient, potentially saving more American Indian and Alaska Native lives. California tribes are working with Congressman Kevin Kiley and other representatives to advance this initiative. The IHS Facility Support Account is underfunded, affecting services such as a master plan update and technical assistance for tribal health programs. The California area receives only $2.7 million for 1.1 million square feet of clinical space, which is about $2.30 per square foot, significantly less than the $9 in similar areas and $14.50 in better funded regions. This funding shortfall leaves California tribal health programs with unmet facility needs and inadequate support, hindering their competitiveness for IHS resources. I request that the subcommittee include provisions in the appropriations bill to ensure equitable FSA funding for the California IHS area, ideally mandating parity in funding between tribal health programs and IHS facilities. I request that the subcommittee include provisions in the appropriations bill to ensure, I'm sorry, I was reading that again. Regarding the IHS alignment proposal, the vast majority of California tribes oppose it. We need our local IHS area office to keep functioning as it has historically, especially in making decisions about local operations. On behalf of the Riverside San Bernardino County Indian Health and our member tribes and patients, thank you for this important hearing on IHS and related programs. I urge your support for my outline requests and look forward to discussing them further. Thank you.
Thank you. Esther, you're next.
Hi, good afternoon. I'm Chair Simpson and Ranking Member Pingree. Oh, it's on. Okay, great. So, good afternoon. Chair Simpson and Ranking Member Pingree. I apologize, I have a little bit of a cold. I just stuffed my whole mouth full of candy, so let's hope that that doesn't come off too much. First I have to say it's a real honor to be here. I'm so grateful to the staff who continue to make time for us, even despite, flight challenges and things like that. Today, I'm asking you to really invest in our Urban Indian Health Organization line item. And for the first time, I'm asking for over $1 billion. So $1,093,999,000. I'm saying that number out loud because it's slightly different from my written testimony, and I want you to know that I'm aligning with our national tribal budget formulation. That's very important. But I have to ask for this money because we all agreed that we wouldn't go backwards. And trust me, I know how hard you have fought to make sure that that doesn't happen, especially you, Chair Simpson. I've heard it throughout Congress, how hard you have fought for us to maintain our funding. And at the same time, like you said, Ranking Member Pingree, I am very concerned about the Medicaid cuts because the Seattle Indian Health Board is not only an urban Indian organization, but we're the first urban Indian organization to become a federally qualified health center. And that means we are dependent upon this third-party revenue to balance out the IHS budget. I know that the federal government understands that IHS has been underfunded since its inception. I also know that the federal government has utilized other resources through SAMHSA, through third-party revenue, billing revenue, through other funding entities to help us offset that budget shortfall. Well, that's not happening now. Now those funds are being threatened. And the thing is that we all made a commitment to one another. Chair Simpson, you said, I need you to be good steward of these resources. So I'm going to tell you what we've done. So our residential treatment program, 92 beds with 15 beds dedicated to serving pregnant and parenting people, opens on July 11th, and I'll invite all of you to that grand opening. We're incredibly proud of that $38 million project. I want to tell you that it's $38 million because I've recently heard that Secretary Kennedy is making $1 billion investment in infrastructure, right, in IHS. and that they're going to use the 1993 priority list to be able to distribute those funds. So if our 92-bed residential treatment program costed $38 million and has taken us roughly 5 years to get going, think about how far $1 billion is going to go. That's not very far. Think about the fact that we have a priority list from 1993. Why is infrastructure important? Because building infrastructure allows us to use innovative approaches to diversify our revenue streams, right? One of the things that we bond over is the fact that business is important and we can function in an effective business manner. The Seattle Indian Health Board, we've been able to establish our first LLCs and our subsidiary businesses to begin to diversify our revenue streams. This would have been impossible without the infrastructure investment in those ARPA funds. I hate to even bring up the $1 billion investment in infrastructure because urban programs are not eligible. And I never, ever want to take resources from our tribal partners. They've been waiting since 1993. And at the same time, our urban programs are trying to serve those 76% of American Indians, Alaska Natives living in urban areas. So we need to make sure that we actually have some funds that are dedicated to that. And back to what Abigail's point was, is we have magic happening in Indian country. We have always been your greatest return on investment. We need to take a look at those wins, and we need to reinvest our resources into those wins. When you think of a program like Seattle Indian Health Board that started with one family medicine residency program, and now we have 32 training programs, 32 learning programs, that should equate to an additional investment. See where I'm coming from? Those are the things that have value. I just want to say another thing that you've really invested in is getting traditional new medicine to become billable practice, particularly Representative Elsie, and circulated that letter that got 4 states to be approved for that. In the state of Washington, I want you to understand that because urban programs are not eligible for 100% FMAP, we're likely to be removed from that option being eligible, which is so sad because the Seattle Indian Health Board is the only organization that has a proven mechanism for that billing system. We have to go back. We now have real data. The CBO score can be real. And use that data to make sure that 100% FMAP is implemented in perpetuity. I need your help on this, guys. I can do magic with that money. Just help me get there. Thank you very much.
Thank you. Aaron.
Good afternoon. My name is Aaron Hines, and I'm the chair of the Northwest Portland Area Indian Health Board, and I also serve as the chief executive officer of the Yellowhawk Tribal Health Center, which is owned and operated by the Confederated Tribes of the Umatilla Indian Reservation. Just the little bit that I've already sat here, and I'm sure you guys know this, the comments that I'm going to share with you are no different than what you've already heard so far, just in a different way, in a different form. But I think our message across Indian country is the same, and I think you guys are hearing it so far, and I hope the committee does take to heart what we're sharing with you, as you are already hearing the direct impacts that IHS has on our tribes and our members, or the lack of action from the administration. And so as we talk to you as our elected officials, we really do hope that you hear our words, because as it's already been mentioned, that these words have been shared time and time again, year after year, the same message over and over, yet there's little to no action that has a great impact. And so, but that's not going to deter us from coming here time and time again to share the same message over and over again until we are heard, so that we can ensure that the services that are supposed to be provided to our people are met. And so on that note, I'll start off with, our first request is to, again, ensure that this committee, as well as Congress and the administration, continue to honor the trust responsibility that the federal government owes to the tribes, and to uphold the legal and moral obligation of the treaty obligations that are outlined in all of the treaties that we have with the tribes, and to ensure that these words that have been written and agreed to by the leaders that came before us are not falling on deaf ears. It's already been noted, but again, we'll say it again, that our first ask is to take a look at the advanced appropriations as we look to FY 26, 27, 28, that number that has been noted already, $76 billion. And looking at what's currently in the budget for FY 26 is just a little over $8 billion. So there's quite a bit of a shortfall as it comes to fully funding IHS. And so towards that end, as we talk about mandatory funding, whether it's for 105L leases or contract support costs, which on that note, it was a win a couple years ago when the Supreme Court did rule that contract support costs did need to be covered through IHS dollars. That while that's the ruling, one thing that wasn't added was that there was not more money appropriated to IHS to help cover those costs. And so that is a concern that we have still, and even prior to that, is that this pie continues to get sliced smaller and smaller and smaller. And so we are doing our best on our end, and I think was just shared by Ms. Lucero, that we can do that magic. And when those dollars are appropriated to us, we best know how to utilize and spend those dollars. And as it pertains to the Portland area, we are one of the areas that has no IHS or 638 hospitals. And so for our funding and in our request to IHS, we look to increase our purchased and referred care dollars. And so until such time, and we are currently working on a specialty referral center for the Portland area, and until such time, though, as the rising cost of healthcare continues to go up, and without an increase to PRC dollars, that is a concern for us, as while our tribes are doing their best to be sustainable, whether it's through third-party billing or other means and resources, this is a concern for us. And again, probably just on another note, we'd like to see that some of these dollars that come through, whether it's for the special diabetes program for Indians or the behavioral health initiative, that those grant funding opportunities be redirected back through contracts and compacts to tribes, so that we're not competing for these dollars. That has been an ongoing concern and issue when we have to compete with our fellow tribes to try to obtain those dollars, because they do have great impacts on our communities. I know I can speak for the Umatilla tribe that the behavioral health initiative dollars that we've received has been tremendous, especially as mental health has been a huge issue in our area, and especially after dealing with COVID and seeing a mass exodus of the behavioral health professionals following that now more than ever, that's one of our top issues that we're dealing with, as well as diabetes and obesity in our community. But this is just an example of again, we need the money, and we hope that this committee can carry that message to the full committee, to the rest of Congress, and we'll continue to work with the administration on there's a lot of issues that we need help on and work. And we look forward to working with you, and thank you for your help.
Thank you. I was just checking. We are voting now, right?
Yes, 8 minutes left.
What's that?
8 minutes left.
Ah, okay. Andrew, you're next.
All right, is that on?
Yes.
Okay, Wasa Yiti, Gunashchi Shati Adi. Good afternoon. My name is Leandra Ross, and I'm a citizen of the Tlingit and Haida Tribes of Alaska and a tribal member of Salamatoff. I'm sharing with you today as my capacity as the Vice President of Executive and Tribal Services for South Central Foundation, and I want to thank Chairman Simpson, Ranking Member Pingree, and the distinguished members of the subcommittee for holding these hearings. Gunashchish. SCF is the designated tribal health care organization for 12 federally recognized Alaska Native tribes and operates under the authority of Cook Inlet Region. SCF is one of the 10 largest employers in Alaska and provides health care services to over 70,000 customer owners. This is SCF's term for patients, as we're both the customers of our health system and we own our own healthcare journey. Through the Alaska Native Medical Center, which SCF co-manages with partner the Alaska Native Tribal Health Consortium, we also provide specialty inpatient and outpatient services to more than 155,000 Alaska Native and American Indian people statewide. Across SCF, we provide primary care, dental, behavioral health, and addiction treatment services totaling more than 850,000 encounters each year. SCF services depend on the Indian Health Service appropriations. While there is much covered in my written testimony, I'll highlight just a few topics today. The first of these being workforce development and housing. Alaska is arguably one of the most beautiful states, but it's also not the easiest place to recruit people to come and live due to extreme cold, seasonal darkness, and isolation. Combined with nationwide shortage of healthcare workers, this makes recruitment in rural communities off the road system difficult. In many of the rural communities that we partner with, there's just not enough housing. Additional federal support would significantly strengthen our ability to recruit and retrain providers to reliably deliver care, especially as the new recent rural healthcare transformation funding cannot be used for these purposes. Federal funding for workforce housing is further constrained by Build America, Buy America Act requirements. The goals of BABA are important, but it creates barriers which often make projects infeasible in Alaska due to high costs. Existing waivers take significant time and can cause tribes to miss full construction seasons, driving costs even higher. We recommend that Congress adopt a narrow tribal exemption to support efficient use of federal funding. Further, we recommend that the subcommittee build on the progress made in the FY26 budget for Indian health professions and direct IHS through report language to fully utilize its authority to set aside funding for workforce development scholarships administered by tribes and tribal organizations. The next topic I'd like to highlight is behavioral health funding. Mental health is so important, and while there are modest increases in the mental health and alcohol and substance abuse accounts last year, they remain insufficient to address needs. Currently, we rely on a patchwork of grants and third-party reimbursements to maintain services, leaving programs vulnerable to funding instability. Tribes have long requested that IHS behavioral health grants be delivered through self-governance, contracts, and compacts, and we urge the subcommittee to re-adopt report language from the FY19 Consolidated Appropriations Act supporting this approach. And I love what Ms. Lusardo had to share, that we're the best return on investment. And I'd say that that's true in Alaska also. We're happy to share that we will be opening a crisis stabilization and crisis residential, as well as expanded detox facility called Yesh Jeshta, I Am Safe Place, and would love to have members come to that opening this summer. So finally, advanced appropriations and mandatory funding. We've heard this throughout, and I'll just be echoing the remarks. I know the subcommittee is no stranger to the ask that IHS receives advanced appropriation, but this remains crucial in FY27. I appreciate your comments. Chairman Simpson, before advanced appropriations, the 2019 government shutdown demonstrated the risk this posed for tribal communities, and the FY 2026 shutdown showed that advanced appropriations work to keep clinics open during federal funding disruption, saving lives. To take this issue off of all of our lists, it's time for Congress to implement mandatory funding for IHS key obligations, specifically contract support costs and Section 105L lease payments. SCF requests that Congress prioritize these payments by making them mandatory, even if it's not possible for other IHS appropriations yet. Their current status outside advanced appropriations leaves them unprotected in the event of a shutdown. Mandatory contract support costs and 105L payments would ensure these areas do not continue to stress the limited funding allocation the subcommittee receives. Gunesh Chish, thank you for the opportunity to provide testimony on behalf of South Central Foundation and the Alaska Native people we partner with on our journey of health and wellness.
Thank you. Thank you all for being here. I'm going to have to remember that term, limited lightness. Is that what you're, limited daylight?
Yeah,
Yeah.
seasonal,
Yeah.
seasonal darkness.
Oh, seasonal darkness. Okay. Uh, I, uh, I'm just, well, first of all, thanks for all you do. I've been doing this for a long time. And we've had hearings for a long time. A lot of you have come back many times. And I've wondered if in the back of your mind going, here we go again. We're always back asking same thing, da-da-da-da, you know, all that kind of stuff. And does anybody hear us? Good question. I will tell you, people on this committee hear you. The reason that we've been able to do as well as we have in a bipartisan way is because we do hear you. Do we get everything we want? No. This would be different if I were king for a day or if Shelley were queen for a day, you know? But you guys do make a difference. And we're trying to do our best. And I know that because we hear you say thank you for not cutting our budget like we did others and that kind of stuff. But you kind of wonder, you know, how can you not fund treaty and trust responsibilities when you're funding other things that are more discretionary, you know? It's a good question. But it's one of those things that we fight for. And I will tell you, out of all of Congress, this is the area that there is probably more bipartisan cooperation and support for than any other area that I've dealt with. So in case you wonder if you're doing any good or if this is just a waste of time, it's not. It's important to us that you come and talk to us. And it's important for us that we get out and talk to you too. So, Shelley?
Chair. And yeah, we're gonna have to run to votes, but I just wanted to thank you too for all being here. Really appreciated the work that you're doing, that all that you were saying, and just mention a couple of things on the BABA waivers. Interestingly, I just sent a letter to HUD myself last week because in my home state of Maine, affordable housing is being slowed up by that because housing is way more complicated than building roads and bridges. So while I believe in Buy America, I can't even imagine what it's like in Alaska to try to build, but we've had some huge complications. And I also think they're just not moving fast enough on granting the waiver. So we're definitely following that one closely. And I know that's not actually health, but I appreciate that you brought it up because housing and, you know, these things are all related. And I appreciate the work that you're doing in your testimony, and also thought I'll try to understand better the issues that you have as an urban health center, not being able to get the traditional Indian medicines covered, because that just seems so critically important in the work that people have been doing, and incorporating that seems to just add so much more value to the health system. So if there's anything else we can do to be useful on that, I don't understand it that well, but I'm happy to. And just again, really appreciate all of you. Your testimony was very good, and thank you for being with us.
Would you like a quick response? Do you have to go?
I gotta go.
Okay.
No, thank you. We really do appreciate you being here today. And we've got about 30 seconds left in our vote on the floor.
Yeah.
So committee stands in recess and we'll reconvene for our last two panels right after this vote series.
Thank you. Fill you in.